Good afternoon. I'm Liz Purnell, an Education and Training Specialist with the Institute of Child Nutrition. Welcome to the Team Up Thursdays webinar on local school wellness policies. The Institute of Child Nutrition, along with its Applied Research Division, has collaborated with USDA to develop Team Up for school nutrition success. Team Up is a unique learning experience designed to enhance the operation of school nutrition programs. It provides tailored technical assistance to programs that want to maintain a healthy environment and increase student meal program participation. As a follow-up to the Team Up pilot workshop in 2014, a monthly webinar series was launched. It serves as a platform to further enhance partnerships and to provide an opportunity for all school nutrition professionals to discuss issues and provide solutions and best practices used in districts' key areas. The ICN has created a website for all materials and resources specifically related to Team Up. You can find the information at bicn.org/teamup. Today's webinar features a panel of experts who will discuss how local school wellness policies can be used to institute positive changes in the lunchrooms to support meal pattern requirements. We will also learn about the tools and resources that are currently available from USDA and the CDC. I'm pleased to briefly introduce our panelists today. Francille, EKG, will start us off. She is a nutritionist with USDA's Food and Nutrition Service. Next, we will hear from Kaitlyn Merlot, who is a health scientist in the Division of Population Health at the Centers for Disease Control and Prevention. And last but not least, we will hear from Megan Lopes, who is a Team Nutrition Staff Specialist in the Office of School and Community Nutrition Programs with the Maryland Department of Education. During today's webinar, all attendees are muted. There will be time for questions following each speaker's presentation. If you have a question, please type it in the question box on your screen. Now, Francille, I'll turn it over to you.
Thank you. Good afternoon. My name is Francille, and I'm a nutritionist for the USDA's Food and Nutrition Service. And thank you for inviting me to talk today about the Local School Wellness Policy Final Rule and related team nutrition resources. I want to provide a brief background about Team Nutrition in case you haven't heard of us. Team Nutrition is an initiative of the Department of Agriculture's Food and Nutrition Service that supports the child nutrition programs. Team Nutrition provides a number of free nutrition education materials that the public can access through our website. Schools that participate in one of the child nutrition programs, like school breakfast or school lunch, can also request free printed copies of materials for their schools by using the order form on our website. Team Nutrition also provides funding to help states provide training and resources to schools and child care centers to improve the health of children. Only state agencies administering child nutrition programs may apply for the grant. However, many states have a Memorandum of Understanding or MOUs with other state agencies that either co-write the grant application or can be contracted out to conduct many of the grant activities. So, for example, if the Department of Education administers the child nutrition programs in your state, but the Department of Health has a lot of existing staff and resources to conduct new projects, they can partner together and share the funding, as long as the Department of Education is the one submitting the reports, managing the financial aspect, and providing at least 0.25 FTEs for the project director. Some examples of how the funds are used by states include providing statewide and regional local school wellness policy trainings, or giving sub-grants to schools to fund wellness events. Maryland's Department of Education will talk about their project a little bit later in the webinar. Each year, Teen Nutrition Training Grants release an RFA around February or March. And the specific goals and objectives and structure can vary each year. For FY16, it was a competitive grant, and we were able to fund 14 states at a total of $6.7 million and these grants will run for 3 years. So be sure to reach out to your state to see if they have a Team Nutrition Training grant. And let them know if you would be interested in partnering on a future application. The website shown at the bottom of the slide has all the grantees listed for each year and a summary of their project. I also want to make sure everyone has heard of Team Nutrition Schools. Any school in the U.S. can enroll for free to become a Team Nutrition School, which will allow them to collaborate with other Team Nutrition schools, be among the first to hear about new Team Nutrition materials through our e-newsletter. They're eligible to apply for the Healthier U.S. School Challenge Award, Smarter Lunchrooms, and receive special nutrition education and promotion materials that are reserved just for Team Nutrition schools. Earlier this year, we ran a promotion with our very popular stickers that promote school breakfast. And only schools enrolled as Team Nutrition schools had access to order these stickers for their students for free. Team Nutrition School is just a few easy steps. From the Team Nutrition homepage, click on the Become a Team Nutrition School under the How to Apply on the left navigation bar. Then click on Sign Up and fill out the form. You can also use the online search to see if a school is already signed up to be a Team Nutrition School and check to see that the contact information is correct. You can update the information if it's out of date. Now some background on local school wellness policies. In 2004, Congress passed the Child Nutrition and WIC Reauthorization Act. This act required by law that all districts participating in the child nutrition programs create local school wellness policies by school year 2006. Then, in 2010, Congress passed the Healthy Hunger-Free Kids Act and added new provisions for the local school wellness policies related to implementation, evaluation, and publicly reporting on progress. On July 29, 2016, the final rule was released, which is what everyone is so excited about and starting to work on now. In addition to the changes to the local school wellness policies, the Healthy Hunger-Free Kids Act allowed USDA to update school nutrition standards to reflect recommendations from the National Academy of Medicine and the Dietary Guidelines for Americans. More than 99% of all schools nationwide are meeting these updated standards. Under the new standards, school meals are providing children more whole grains, fruits, vegetables, lean meat, low-fat dairy, as well as less sugar, fat, and sodium. This is a list of requirements in the final rule of what the wellness policy must contain, and you can see at the very top is nutrition guidelines for all foods. Wellness policies must be consistent with the new meal pattern regulations in addition to the Smart Snack standards. It also requires districts or local education agencies, LEAs, to set their own standards for other food brought to school that isn't sold. For example, classroom parties and classroom snacks and food incentives or rewards. Since I don't have time to go over all the requirements this afternoon, I highly recommend checking out the simple summary of the final rule requirements that is available on our website. It is a double-sided PDF that provides a nice overview that you can share with everyone involved in local school wellness policies. Another place you will find a summary of the final rule is on the Healthy Meals Resource System. The Healthy Meals Resource System is a USDA website that has thousands of resources for everything you can possibly think of around local school wellness policies and school meals. The first link on the main navigation page is the wellness policy process. This includes sub-pages like assembling the team, model policies, evaluation resources, and more. The second link on the main page that is shown on the slide has the wellness policy elements. These subpages include links to nutrition education resources, resources on physical activity, healthy fundraisers and celebration, and school gardening. There are also links for success stories, funding opportunities, and lastly, training resources to find webinars and PowerPoints about wellness policies. And we plan to update next month all of the recent webinars we have held. One of the new aspects of the final rule is the requirement to evaluate how the local school wellness policy compares to model policies. Not only is this a requirement, but it is also helpful to look at other model policies to get ideas for new goals. Team Nutrition has compiled a list of model wellness policies that can be found on the Healthy Meals resource system using the web address at the bottom of the slide. By mid-November, Team Nutrition is planning to release a new local school wellness policy outreach toolkit to increase awareness of the components of the policy and provide strategies for school staff and parents to get involved. This toolkit includes lots of customizable templates to help schools communicate with parents and school staff about the wellness policy and encourage broader participation. The outreach toolkit includes a letter to principals, parent flyer, both in English and Spanish, presentation for staff, presentation for parents, newsletter article, and social media post. It also comes with a cover letter that has instructions for the wellness coordinator or whoever is responsible for the wellness policy on how best to use the kit. Then that person can edit the template to include their URL for their wellness policy, information on wellness committee meeting dates and location, and other district-specific information before disseminating to school staff and parents. School staff can then send the flyers home to parents, post them around the school halls or in the cafeteria, and hand them out at a school event. The presentations can be given during a PTA meeting or staff trainings and can be cut and added to meet your unique needs. You can then use the sample social media post with a picture of one of your healthy celebrations to show how your wellness policy is working. Be sure to follow us on Twitter or sign up for our e-newsletter to be informed of its release. Another resource you can use to spread the word about wellness policies is the Team Nutrition Healthier Middle Schools Kit. It includes materials for multiple audiences, including parents, principals, teachers, students, and school food service professionals. These materials were tested to confirm the way the information is presented would resonate with their intended audiences and make them more likely to get involved in school wellness. For each target audience, there's a double-sided flyer and videos that are short but really get the message across on how everyone plays a role in wellness. In a couple of minutes, I will show you how you can order these awesome materials for free. Team Nutrition also just released a new resource to help everyone involved in offering snacks in school understand the Smart Snack Standards. Since these standards must be a part of your wellness policy, this is a great tool to help make sure everyone understands them and that it is being implemented. The resource is called A Guide to Smart Snacks and is currently available on the Team Nutrition website to download, and printed copies can also be ordered. Team Nutrition also has a resource to support your efforts to promote nutrition and physical activity at school events. The super fun Team Nutrition Popular Events Idea Booklet targets grades K through 8 and presents ideas for 20 themed events, both large and small, and spotlights real-life events at schools across the country. The booklet includes handouts, templates, and other free resources to support school events. Lastly, we have some brand new resources to help schools communicate with families about the changes to school breakfast and school lunch. There's a My Plate Guide to School Lunch and My Plate Guide to School Breakfast, which is shown on the slide. There are many more teen nutrition resources for nutrition education and promotion that I did not go over that you should check out on our website and share with parents and teachers. Many of our materials are available in print for free using the resource order form. All of our materials are available to download from our website using the resource library as shown on the slide. If you have any questions about the teen nutrition materials we covered today, please feel free to ask them when we open it up to questions, or you can email us at the address on the slide. Be sure to follow us on Twitter to stay on top of all the latest teen nutrition news. Now, I'll open it up to some questions.
Francille, do you see any questions?
Questions. I'll see how many I can. I do. I'm going to read through some of them and see which ones I can answer quickly. One of the questions is, where can we get the SMART? I believe the guide to SMART snacks that was shown towards the end of the presentation. And that is also on our website. And look under SMART snacks, you will see this guide. It's about 2 pages, front and back, that can be downloaded. One of the other questions is, does it matter where the funding for the non-sold food comes from, such as the school pays for the food used as snacks in classrooms from an outside source? It does not matter where the funding for that food comes from. The school district has set for food brought for the class party or donated from an outside source. And see if I can get one more answered. One of the other questions is, can schools still have ice cream and cake, etc.? So the answer to that is the schools set nutrition standards for foods that are not a part of SMART snacks and not a part of a reimbursable school meal. So that depends on what the guidelines or standards that particular school district has set. But if it's part of a school lunch and it doesn't meet the standards, then you can't have it. If it's sold as a part of SMART snacks and it does not meet the standards, you can't have it. The remaining questions I think I'm going to take offline, mostly for time's sake because there's quite a few. So I'm going to turn over the presentation to Kaitlyn from CDC to present on their resources for local wellness policies.
Great, thanks so much, Francille. Good afternoon, everyone. My name is Kaitlyn Merlot. I work at CDC's Division of Population Health, School Health Branch. And our school health work really focuses on a comprehensive approach. We really see local school wellness policies as a critical strategy to support students' health, but also their academic success. It's a pleasure to be on the call today to share some of our resources to help advance wellness policy work. So today I'll be focusing on resources that CDC has to help make the case for wellness. So basically why wellness policies are important for students now, but also in the future. I'll also share a resource around assessing the school environment so that districts can adopt policies that actually meet the needs of students in the schools in that district. Then I'll review some evidence-based strategies, so what we know from research and practice that actually works. And I'll also share resources around implementing wellness policies and engaging school staff, families, and students in the process. So I'm sure everyone on the call recognizes that schools have so many competing priorities, and that can really make it challenging to get support for wellness councils and wellness policies. However, one strategy that can help with this is to talk to potential wellness committee members and school leadership about the link between student health and academic achievement. We've developed a framework to help empower individuals to use this link between health and academic achievement to make the case for school wellness. This framework follows 3 key steps, which are, first, to know the evidence about the link between healthy eating, physical activity, and improved academic achievement. To share these messages with key stakeholders to help make the case for supporting healthy eating and physical activity in schools, and then to take actions to improve health and wellness in schools. We've developed a really nice resource document that describes this framework. It provides a great overview of the key research demonstrating the link between health and academic achievement. And then it highlights some of those core messages that can be shared with different audiences to gain support for wellness work. And it also outlines action steps to take to help make schools a place for health and learning. In addition to the overview document, we've developed a set of presentation slides, and these are great because they have the speaker notes already embedded in them, and they can easily be integrated into a presentation that you might be giving at a training or a school board meeting or a PCA meeting. So I encourage you to look at these resources. One of the great things about wellness policies is that the federal regulations really allow for flexibility, so that the content of the policy reflects the needs of each district. There's actually new evidence showing that when wellness policies are developed in a way to reflect the needs of the district, they're actually stronger and more likely to be implemented than simply copying and pasting wellness policy language from a model wellness policy. However, in order to create a wellness policy that truly reflects the needs of the district, it's first important to know what those needs are. And the School Health Index is a tool that can help with this. School Health Index is an online self-assessment and planning tool, and it enables schools to identify strengths and weaknesses of health policies and practices, and then develop an action plan for improving student health. School Health Index is a school-level tool that districts can use the results from School Health Index from individual schools to help inform new goals or revise existing goals in a wellness policy. So an example I like to use is that if all of the elementary schools in a district use School Health Index and report they're not providing a 20-minute recess to students each day, that information can then be used to create a new goal for the wellness policy that all schools will provide a 20-minute recess each day. School Health Index is very comprehensive. It addresses multiple components of school health, but it includes a lot of questions related to school nutrition and physical activity and physical education. It's recently been updated to include nutrition content that aligns with new USDA regulations and best practices for school meals, smart snacks and school nutrition standards, water access, food and beverage marketing, smarter lunchroom strategies, healthy fundraisers, and healthy school celebrations and rewards. Some of the physical activity topics that are addressed through School Health Index include recess, physical education, walk and bike to school programs, before and after school physical activity opportunities, and classroom physical activity breaks. One thing that we commonly hear from schools is that there are just too many different assessment tools out there. So we've really worked hard over the past several years to integrate School Health Index into existing programs. So for example, the assessment tool for the Alliance for a Healthier Generation's Healthy Schools program is a modified version of School Health Index. And the same is true for Action for Healthy Kids grants and Let's Move Active Schools. One of the new requirements for wellness policies is that local education agencies or school districts are now required to review and consider evidence-based strategies when determining their wellness policy goals. CDC's School Health Guidelines to Promote Healthy Eating and Physical Activity is a great reference document that describes the evidence behind recommended strategies. So if you're interested in knowing the research behind providing recess before lunch or the recommendations for physical activity or school meal programs, this is a great resource to look at. It includes 9 evidence-based guidelines and 33 evidence-based strategies that can be incorporated into a local school wellness policy. Please keep in mind this document, it was published in 2011, so we know that there have been a lot of studies in these areas published since then, and we do plan to update the guidelines document again in the next few years. In addition to reviewing evidence-based practices, it can be very helpful to also review practice-based evidence, which is what has worked for other districts and schools. CDC worked with USDA to develop a collection of stories that highlight districts and schools that have successfully put their wellness policies into action. The stories provide best practices that other schools and districts can hopefully duplicate or adapt when implementing their own wellness policy. Some of the key themes from these stories highlight the importance of having a wellness champion to really lead the wellness policy process, the importance of having a diverse wellness council to develop the wellness policy but also to implement programs and activities that support the wellness policy, the benefit of partnering with community organizations that can provide expertise and resources to implement wellness policy goals, and then also the benefit of including parents and students in the process to get their buy-in, and we know this is really important for making sure that the wellness policy is really put into action. One of the other themes that came about from developing these success stories was that while many schools and districts had great stories and anecdotal evidence of the success of their wellness policy, most districts and schools are not collecting quantitative data to show the results of their wellness activities. So this is a great opportunity for districts and schools to consider partnering with other organizations for help with evaluating their wellness policy. For example, a local health department or a local university would be able to help with this type of work. I'm also really excited to share with you a resource that we published this summer. This document is the comprehensive framework for addressing the school nutrition environment and services. And it includes a new graphic, which is that circular model that you see on the right-hand side of the screen, that can be used to help describe all of the areas in the school that can influence students' access to and consumption of healthy foods and beverages. So when we are talking about a healthy school nutrition environment, we mean that students have access to healthy and appealing foods and beverages through school meal programs, vending machines, school stores, fundraisers, classroom parties, etc. That there are consistent messages about food and healthy eating across the school environment and school curricula, and that students have opportunities to learn about healthy eating, and that can include anything from a health education class to the nutrition education that's being provided in the cafeteria, as well as school gardens. So this document defines each of the elements of the model and then identifies key resources to support each element. We've also expanded our web pages to reflect this new model. So you can see on this overview tab, we describe what we mean by a healthy school nutrition environment. And then there's a tab for each component that goes into more detail. So for example, on the Celebrations and Rewards tab, there's a description about the topic, some ideas for healthy celebrations and non-food rewards, and then additional resources to help implement the guidance. Another set of resources that we worked on in collaboration with researchers from Bridging the Gap is a series of research briefs on various aspects of local wellness policies. These briefs use nationally representative data to examine the strength of wellness policies in 6 key areas, including the school nutrition environment, physical activity and physical education, recess, water access, marketing and promotion of foods and beverages, and addressing weight status measurement in schools. And along with these briefs are a really nice set of PowerPoint slides, again, that have talking points that are ready to go. so that you can incorporate some of this information into presentations that you might be giving about wellness policies. One of the key points that we talk about with wellness policies is that in order for them to actually be implemented, it's critical to build support across the school campus, school staff, families, and students. CDC has several resources that focus on building support for changes in the school environment. The first one is the Increasing Access to Drinking Water in Schools Toolkit, which has information and tools to meet the free drinking water requirements for school meal programs, but to also help make clean, free drinking water readily available through multiple points in the school setting. We've also created Parents for Healthy Schools, which is a great set of resources that school groups like a PTA or a PTO or a wellness committee can use to engage parents in helping create healthy school environments for students. And these resources provide parents with practical strategies and actions to get involved to improve the school environment. And lastly, Tips for Teachers is a great resource that outlines actions that teachers can take to promote healthy eating and physical activity in their classrooms. In addition to the CDC and USDA resources that we share today, there are many other great resources for wellness policies that we'd like to share. So one is the Action for Healthy Kids Wellness Policy Tool, and that's shown on the left-hand side of the slide. It outlines a 7-step process for wellness policies, and it also highlights key resources to help schools accomplish each step of the process. WellStat is another tool that you all may be familiar with. It was developed by researchers at the Rudd Center, and it can be used to measure the quality of existing school wellness policies. So if you want to know, how strong your wellness policy is compared to recommendations, this is the great tool to use, and then it will provide you some options for how to strengthen wellness policy language. The Institute of Child Nutrition has a great resource that provides school districts with step-by-step instructions for conducting an evaluation of local wellness policy activities. And the Alliance for a Healthier Generation has many great resources as well, including an online wellness policy toolkit. I wanted to spend just a few minutes talking about some of the funding opportunities that we have at CDC and how there may be opportunities to collaborate to advance school wellness work in your state. CDC provides funding to state health departments to address a variety of health topics, and we're currently in the 4th year of a 5-year cooperative agreement that includes 4 different CDC programs working together to support chronic disease prevention programs nationwide. The name of this cooperative agreement is really long. It's called State Public Health Actions to Prevent and Control Diabetes, Heart Disease, Obesity, and Associated Risk Factors and Promote School Health. But because that's such a long name, we just abbreviate it and call it 1305. Within 1305, the school health work focuses on 3 key areas: creating healthy school nutrition environments, improving physical education and physical activity opportunities, and helping students manage chronic health conditions. The 1305 school nutrition strategies focus on training and technical assistance to help districts and schools establish nutrition standards for all competitive foods, establish policies that prohibit advertising of unhealthy foods, implement strategies to promote healthy foods and beverages, and increase access to drinking water. So you can see that the school nutrition environment model that we talked about earlier really reflects the work that's happening in states through the 1305 cooperative agreement. And local school wellness policies are the perfect opportunity to address these strategies. So because local wellness policies are a major focus for both 1305 and Team Nutrition training grants, we wanted to share some ideas of how 1305 grantees and state agencies that oversee school nutrition programs can collaborate to advance wellness policies. So one of the first steps is to reach out to state health departments to find out more about the work that they're doing through 1305. All state health departments are funded for this school nutrition work in some capacity, and they're all set up a little differently. But the school health work is likely taking place in the chronic disease branch, so that is probably the best place to start making connections. Collaborating on trainings and developing materials is another great way to ensure that districts and schools are receiving consistent messages about wellness policies. We also recommend sharing partner lists and contacts. So it's likely that any training or material that you're sharing with your own constituents would likely be relevant to work of other schools and districts and partner organizations in your state. And Francine mentioned this as well, but you may want to consider co-authoring future grant applications. So working on a grant application together for a team nutrition training grant is a great way to clarify the needs of schools in your state and to have a plan of action that multiple agencies can support. Other ideas for collaboration include inviting each other to project events and trainings and then scheduling quarterly calls to provide updates and discuss opportunities for future collaboration. So really all of these ideas can help state agencies leverage resources and then share consistent information. I also want to mention that in addition to funding state health departments, CDC has a new cooperative agreement working with 4 national non-governmental organizations on school health work. This work focuses on training and technical assistance as well, including developing a training of trainers model in the areas of nutrition, physical education, physical activity, healthy out of school time, and managing chronic conditions. The 4 organizations and their areas of focus are shown on the slide, and this may be another opportunity to collaborate on wellness policy work in your state. So I invite you to come check out our website and our resources. All of the resources that I mentioned today are available at no cost, so please help us share these tools with schools in your state. I've also included my contact information, so please feel free to contact me if you have any questions. And I'll now take a few questions. Feel free to type your questions in the chat box. And Melissa, it looks like a lot of the questions that are coming in are probably something that FNS would want to respond to. Maybe we can follow up later. So somebody asked, of all the wellness policy assessment tools available, which is your favorite? So the one that we promote at CDC is WellStat for assessing the quality of a written wellness policy. That one, it aligns really well with the final rule. They're actually going to be updating it again to make sure that everything cross-checks with the final rule. But I know that some states have adapted WellStat and have their own tools, and so it probably just depends what state you're in. So from a national perspective, we really highly recommend WellStat. It's all online, and you can go back and revisit your assessment to make modifications as needed. But there are a lot of great state tools available as well. There is a question about, is there a place to find consolidated information on 1305 funds? And there's a website. Let me see if I put it on the slide. If not, I can, yes, on my slide 15, which will be available, I guess ICN will follow up with all of our slides. Slide 15 has the website where you can find out additional information about 1305 and who's funded and the funding levels. Okay, another great question about WellStat. So how much time approximately would the WellStat take? And this is in case a superintendent asks. So if you go on the WellStat website, there's a frequently asked questions section, and that's one of the frequently asked questions. According to that website, they say about 45 minutes to assess the policy. However, that of course is going to depend on how familiar you are with the policy, because for each question, you're going to have to go look at the language in the policy and then rate it according to their coding scheme. So they say 45 minutes. You may want to allow a little more time than that just to get familiar with how to use the online WellStat tool. but it is fairly straightforward. There's a question about, do all states have the current 1305 cooperative agreement? And the answer is yes. For school nutrition, all states and the District of Columbia are receiving 1305 funds. Okay, so in the interest of time, we're going to move on. I'm going to turn the presentation over to Megan, but please feel free to email me directly if you have additional questions. Thank you so much for the opportunity to share this information with you.
Okay, good afternoon, everyone. My name is Megan Lopes. As Liz said earlier, I'm the Team Nutrition Grants Coordinator at the Maryland State Department of Education. I'm actually in the Professional Development and Technical Assistance team. So I provide a lot of professional development to school nutrition professionals throughout Maryland, as well as professional development opportunities for teachers and other key stakeholders in the school community environment that really align with a lot of our team nutrition grants and priorities. Just to give you some background information, in Maryland we have 24 local education agencies, school districts, 24 public local education agencies and school districts, and approximately 42 nonprofit private schools and residential child care institutions. So in Maryland, we really have been engaged in supporting local wellness policy implementation really since the legislation came out in 2004 that stated that all LEAs administering the National School Lunch Program and School Breakfast Program would need to have a wellness policy by 2006. So we've been providing training and technical assistance to LEAs. We, in particular, have developed two guides. One guide was developed in 2009, and it was focused on implementing and monitoring wellness policies, really looking at establishing SMART goals, so specific, measurable, attainable, realistic, and time-bound goals, looking at what are priority action steps, looking at how to effectively monitor, and looking at what those expected outcomes are. It's a tool that we continue to use with our LEAs today, especially at our district level. It's important to have a strong implementation plan so schools have the guidance that they need to what to prioritize from year to year. The second guide is a school-level implementation of wellness policies and practice, and this came out in 2004. And in this guide, we established 5 school-level recommendations. The first one was to establish a team. The second was to develop school-level wellness goals and implementation plans. 3 was to identify resources. 4 was to communicate and promote healthy eating and physical activity. And 5 was to gather and report school-level data. And we came up with these recommendations based on a survey and evaluation that we did with the Maryland Wellness Policies and Practices Project. And the Maryland Wellness Policies and Practices Project is a joint partnership between the Department of Education, the Department of Health, in particular the Division of Chronic Disease Prevention, and the University of Maryland, Baltimore Division of Growth and Nutrition. We have been evaluating wellness policies in Maryland, providing training and technical resources through this group. As Kaitlyn mentioned, with the 1305 funding, part of some of the 1305 funds have supported this partnership in the implementation of activities. In the evaluation pieces that we did with with this group, one of the things we did was we evaluated all of our 24 public local education aid agencies policies and then provided them the results and individual feedback based on those WellSat results. We also administered a survey to all schools in Maryland for a school level administrator to fill out about what their current policies and practices looked like at the school level. So with this information and what we saw in some of the results from the WellSat, we came up with those 5 school level recommendations that are in that guide from 2004. And then in 2014, in 2014, we also had a spring conference, which was right when the proposed rule had come out for wellness policy, the final wellness policy rule. So this slide shows a little bit about some of the results of the research and the evaluation we did on local wellness policy implementation. One of the big things we found out was that in our schools, 44% of schools had a wellness team and 56% did not have a wellness team. But for schools that did have a wellness team, they were more likely to be implementing their policy and practices, and they were more likely to be doing other things. They're more likely to, for example, on the right-hand side of the bar, they're 4.9 times more likely to monitor and implement and provide an annual progress report on a local wellness policy, and they were 6 times more likely to secure funds for activities that support nutrition and physical activity for students and staff. So these results really made an impact in the fact that, yes, wellness teams work. It's not just a wellness policy in writing. It really gets wellness policies implemented at the school level. So we said we want to focus here in Maryland a lot more on establishing wellness teams in schools because we know they're important, as well as making sure that there is a wellness champion at schools. So in 2014, as Francine talked about the Team Nutrition Training Grants, Maryland applied for a Team Nutrition Training Grant, and we wanted to focus on wellness policy implementation and monitoring at the school level. And we wanted to focus on providing training, technical assistance, and resources so that we could look at the establishment of those wellness teams and those wellness champions and really look at what was the most effective in that wellness policy implementation piece and what was the best way to support these wellness teams. Was it through training, technical assistance, or resources? And our partners in this grant were University of Maryland, Baltimore, as well as the University of Maryland Extension, the Food and Consumer Science educators. We worked with them to provide the training, and they provided ongoing technical assistance to the schools. When I say resources, resources here means grants and stipends. So we provided the districts a stipend for a wellness champion's time and stipends for wellness policy activities at the school level. Because we wanted to find out whether it was the training, the technical assistance, or the stipends or grants that really impacted the formation of strong wellness teams and wellness policy implementation, we divided our schools up into 3 different groups. We partnered with 5 of our public LEAs, 2 that were in the western part of Maryland, Washington County and Frederick County, 1 in central Maryland, Baltimore County, and then 2 on the eastern shore of Maryland, which were Somerset and Worcester County. We had approximately 60 schools overall, and then within each LEA, we randomized schools into A schools, B schools, and C schools. And as you can see by the diagram here, The A schools received all three, so they received the training, technical assistance, stipends and grants. The Bs received just the training and the stipends and grants, and then C received stipends and grants. So what did the training actually look like? There was a 5-hour training that took place with wellness champions. Some of them had dual wellness champions at their school, so they invited another person to attend with them. One of the big pieces is, what does a wellness policy look like in action? Many of our wellness champions knew they had a wellness policy, but they have not read the wellness policy. It was the first time that they actually looked through it, had a better understanding. In this section of the training, we actually have participants read through their policy and then look at hypothetical scenarios that potentially they may confront in their school, and then strategize how they're going to sort of solve and confront those issues. The second big piece is assessing their school environment. So while you may have a wellness policy, what does your school currently look like, and what is your health and wellness environment look like in your school? And as Kaitlyn mentioned, there are a variety of different tools out there for assessment. We decided to use Alliance for Healthier Generations Healthy Schools Program Assessment, which aligns with the School Health Index, but mainly focused on nutrition and physical activity. Two big pieces of the training were around nutrition and then the physical activity. And around nutrition side, we actually had food service directors and or other leadership in food service at the LEA level come and talk with participants in the training. They talked about school meals, smart snacks. In a couple cases, they actually brought some smart snacks in so that participants could see what was being served in the cafeteria or vending machines or other places in the school environment. I will say overall, this made a huge impact. There are a lot of people that had very negative perceptions about school meals, but by the time that 30 to 45-minute conversation with the food service director was finished, there were a lot of change of attitudes and just new thoughts about what school meals were, and we developed some strong advocates for school meals through the training. The other piece was the physical activity piece, so looking at comprehensive school physical activity programs. So looking at before and after school physical activity, during the school day physical activity, how do we engage family and community in physical activity, and what about physical education? And by the end of the training, participants begin to action plan. They begin to develop some potential goals for their schools, and then they take those goals and they go back and they're focused on forming a team and developing those goals further and implementing them throughout the school year. Wellness Toolkit. So in the training, everybody received a physical copy and an electronic copy of a wellness toolkit. And as you all know, there are a plethora of wellness policy resources out there from CDC, USDA, other states. Other state agencies have developed a lot of these resources. We divided them up into sort of 7 areas, and during the training they utilize some of these resources, and then they're utilizing them throughout the year as well. Another piece of our project was we provided smarter lunchrooms training to food service staff, and there's a 3-hour smarter lunchrooms training that was provided. The school nutrition professionals received 3 hours of professional development hours in communication and marketing. And one of the big things is they learned who their wellness champion was in their school, and they were encouraged to become a member of their wellness team. We also, for many of them, this was the first time that they had actually heard about smarter lunchrooms, experienced smarter lunchrooms. So we walked through some of our traditional smarter lunchrooms training that we've done in the past. So how do we nudge people to healthier foods in the service line? When we think about what can we do with food, what can we say to students along the service line? What about some of our processes and facilities? So can we put fruit at multiple places along the service line so there's more opportunities to nudge our students to take a fruit or vegetable? And then we had our food service directors review the Smarter Lunchroom self-assessment checklist. They prioritized 8 areas where they felt that their cafeteria staff could actually make an influence and make changes to their environment within their schools. And then each school was asked to develop 3 goals and steps and identify individuals responsible and implement those changes throughout the year. So what did some of the school level wellness activities look like? There were a variety of different activities. Definitely there was a strong increase in the number of brain breaks, physical activity breaks that were implemented throughout the day. Some schools started school gardens, others had running clubs, others looked at healthier celebrations in the classroom. The one thing we learned through the process, and we're trying to emphasize even more now, is that there's a plethora of wonderful wellness activities going on in schools, such as 5Ks, one-time events, but how can we create not just a one-time event, but an activity that's going to continue to happen and actually create that system change that we're looking for. So if you do a 5K, you may have a running club with students and staff that happen throughout the year, and the 5K is just the culminating event. And the other big piece was, is this activity really impacting just a small group of people within the school, or is it really impacting the whole school environment? So as you're thinking of prioritizing your activities throughout the year, thinking about, okay, is it just going to be a small group of 6th graders, or am I be able to impact 6th, 7th, and 8th grade throughout my school? So our final results, we're still looking at a lot and analyzing a lot of the data, but one of the big things is when we compare the C, B, and A schools, if you look here on the bar graph, the unique thing is they all increased, basically, they all increased their wellness teams. What we found was there wasn't a statistically significant difference between our A schools and our C and B schools, but we did see that the A schools had the biggest increase in the creation of teams. They were 4.8 times more likely to have the biggest increase compared to the B and C schools. So next steps, in Maryland, we are continuing to provide wellness and CSPAP training. We're also providing ongoing technical assistance to LEAs to update their written wellness policies based on the final rule requirements. We're going to be holding a wellness conference December 19th, where all of our LEAs are requested to bring a team of people from their LEA to the conference to learn more about the final rule. There'll be activities for them to have an opportunity to sort of get technical assistance around their wellness policy. And then we also are continuing our collaboration always with our state health department. And our state health department has released a second round of grants to local health departments to work with local education agencies on their wellness policy implementation plans. So there's ongoing training happening there. And as always, we are always trying to continue our Smarter Lunchroom activities. The one thing I'll mention is that we haven't looked a lot at how these activities have impacted participation rates for the National School Lunch Program and Breakfast Program, and it's something that we will be looking at more closely in our 2016 grant, and taking a closer look at how these activities really impact student selection in school meals as well. So I'm going to open it up to an opportunity for you all to ask questions. And I apologize, I'm just going to take a second here. Okay. It doesn't look like there's any questions right now. I know we did mention a number of resources. I mentioned a number of resources, and those resources are on Maryland State Department of Education's website, and more of our resources that we developed through our Team Nutrition Training Grant will be shared on the Healthy Meals Resource Systems website as well, under Maryland. So what I'm going to do is hand it back to Liz.
Okay. Thank you, Megan, for that great information. Before we conclude today, I have a few announcements concerning Team Up. Upcoming state events are planned during November and December in Arizona, Massachusetts, the Mid-Atlantic and Northeast regions, Puerto Rico, and Washington State. And due to the upcoming holidays, the Team Up Thursdays webinar series will resume in January of 2017. But please remember that all of our webinars are recorded and can be viewed on the Team Up for School Nutrition Success website at www.theicn.org/teamup. I would also like to take this opportunity to mention an upcoming FRAC webinar. The Food Research and Action Center's December Breakfast Matters webinar series will focus on sourcing and storing local fresh foods for school breakfast on December the 8th at 3 p.m. Eastern Time. This webinar will address best practices for sourcing local dairy, grains, proteins, fruits, and vegetables for the school breakfast program. You'll learn strategies for maximizing the shelf life of these food products and how incorporating local foods can boost student satisfaction. So if this topic interests you, you can register at frac.org/frac-events. Previous FRAC webinars are also recorded and are available on their website as well. This concludes our Team Up Thursdays webinar. I would like to thank all listeners and our great panelists. Thanks again for your participation, and have a great day.